Hi, I'm Marc Gorelick, President and CEO of Children's Minnesota, and I'm here today with Adriene Thornton. Adriene is a pediatric nurse who serves as an infection preventionist in our infection prevention and control program. She is also one of our equity leaders. She is in the leadership team of one of our employee resource groups, the Black Employee Empowerment Network, or BEAN. So Adriene, thank you for being here with me today to talk a little bit about equity in COVID-19.
Well, thank you for having me. I'm excited to be here.
But I got to start with congratulations, your 20 years of service here at Children's Minnesota.
Yes, time flies really fast. I've been here since I was 10. But I just love kids and I have a passion for caring. And I'm really excited that I'm able to live that passion through Children's. And so that's why I've been here so long, because it really supports that passion.
Well, that passion shows.
Thank you.
You're out there on the front lines, really in several ways. You're on the front lines of our COVID-19 response by helping keep us all safe, patients, family, staff. Your work in testing and PPE. You're also on the front lines of our equity work, really trying to drive equity, social justice, and fighting structural racism. So thank you for both of those things.
Well, yes. No, I'm very excited to be working with the community. It's definitely a time of change. People are living their conscience, and that's very important for us to change inequities in our country. And it's very exciting to see the changes that are coming about. And as a mom and a Black woman and a single mother, I just want to be out there helping the community to make those changes.
We're seeing that both of those things come together here. I mean, COVID-19 has really revealed some of the inequities in a lot of ways. Can you talk a little bit about how COVID-19 is disproportionately affecting communities of color?
Yes, so we know that African Americans and Black people are disproportionately impacted by health inequities. We have more high blood pressure, we have more diabetes, we have all of these comorbidities that cause us to have disproportionate higher numbers in disease. Those did not go away when COVID-19 appeared. And so when you look at those comorbidities and the fact that we're disproportionately impacted by those, the same thing happens with COVID-19. In addition to that, we have multi-generational homes. And when you have more people, you have more illness in the home. And so none of that changes because we have a new pandemic. It actually gets worse.
And so what are we actually seeing in terms of how much more of an impact it's having on people of color in our community?
So for children specifically, we're seeing that at our hospital, we've treated about 350 kids. About 36% of those are Black, about 22% are Hispanic, and about 13% are Asian. And if you compare that to the state data, the percentages are about the same. And so we're still seeing that in Minnesota, Black people account for 7% of the total population, but we account for about 20% of the COVID disease. So when you're looking at it compared to our percentages of population, we are seeing higher percentages for the Black and brown communities.
Wow. We've been talking about that a lot, but I also understand that there's some misperceptions out there. I know you've been a regular participant in the African American Leadership Forum. They've been doing a bi-weekly series, and you've been a panelist many times. Can you talk a little bit about some of the misperceptions in the Black community that you've commented on before?
Yes, so originally when COVID-19 first came to the U.S., there were rumors and misgivings, and people thought that Black people didn't get COVID-19 because all you heard about were older, elderly white people. And that is not true. Black people do get it. The numbers show that we get it at a disproportionately higher rate. And also we compare it a lot to the influenza. And so a lot of people still think that it's much like the influenza. It will pass, people will die, people will get better, and then it'll be over. And that is not the case with COVID. We're still learning about it. We're still learning how to treat it. We don't know what the long-term impact will be, but what we do know is that anyone and everyone gets COVID. Everyone can get it, everyone can get sick from it, and everyone can die from it. And it doesn't matter what your ethnicity or your race or your age is.
Of course, with all the greater realization now about the inequities that we've got and the racial injustices, there have been a lot of protests around that appropriately. There's been a concern about protests driving some of the COVID-19. What do we know about that?
Well, it's really great that our young people are out being activists and volunteering in the community. We want them to continue to do that, but we want them to be careful. Right now we have limited contact tracing, and so it's a little difficult to be able to determine where the outbreak is occurring related to the activism in the community. But we know that in our 20 to 29-year-olds, we're seeing the highest number of cases. And so we did do some mass testing after the protest, and we know that if people wear masks and maintain their distance, we are able to prevent the spread and transmission of COVID-19. So we don't want people to stop doing what they're doing. Continue to be activists, continue to volunteer, but make sure that you're protecting yourself and others by wearing your mask, washing your hands, and maintaining your distance.
So the 3 W's.
The 3 W's, yes.
And just to repeat, wear your mask, wash your hands, watch your distance.
Yes.
Excellent. Well, Adriene, thank you so much for everything that you are doing, both to keep us safe from COVID-19 and to help keep us safe from structural racism and the other inequities in our society. And thank you for your leadership on this and for taking time to share about it today.
It's my pleasure. Thank you for having me.